Hey, my health enthusiasts, Dr. LeGrand here. Welcome to Healthy Tip Mondays. And today I'm here with Dr. Jack, who's going to talk about how to actually help with headaches. And I'll talk about a few of my own tips too, but we're interviewing Dr. Jack here. He deals with a lot of different headaches when he sees patients, and so he's going to demonstrate what he does in his own practice to help with headaches. So right after this intro, stay tuned. Hi, I'm Dr. LeGrand, and I am a family doctor out here in the state of Washington, where I primarily focus on holistic medicine and conventional medicine, bringing those together to help my patients with their conditions. So if this is your first time on our channel, consider subscribing if you want more information on health tips, on fasting, intermittent fasting, and other detoxification videos. Okay, so Dr. Jack, how long have you been in practice?
28 years.
28 years, okay. So you were kind of mentioning that you do seeing a lot of different patients coming in for a lot of severe headaches.
That is right.
Okay, and what do you typically do?
Well, the first thing when a patient comes through the door, what we need to do is do a full history of the patient to determine what sort of headache it is. There are several different kinds of headaches, but I deal mostly with a structural problem type headaches, where there's possibly a misalignment of the spine creating the headache.
Okay, and so when you see these misalignments of the headaches, is this because people are just sleeping incorrectly, or because of car accidents? What do you typically kind of see for most people?
Well, that's a good question, because there are a variety of different reasons why people have my sort of headaches that I can help with. There's people that have been and had previous injuries to their neck. There are people that have poor posture, who maybe sleep wrong, excuse me.
Now you say that I'm trying to correct my posture.
I know, me too. And, or maybe they get stuck behind a keyboard and looking down all day long.
Okay.
But the number one cause of headache in a lot of cases is just simply stress.
Okay, so stress. So when you see people who are coming in for a lot of stress-associated headaches, what are you typically trying to focus on with helping those people with their headaches?
Well, the first thing I do is do a brief evaluation of them, do some range of motion of the neck, and palpate the neck as well, and I do some orthopedic tests also.
Okay. So can you kind of demonstrate where particularly is the main focus of why people are starting to get headaches? I know you kind of brought a nice little spine for us to demonstrate here.
Well, what I look for is your range of motion. Is not only when they can bend their head forward, and that's your cervical range of motion, forward, back, side to side, turn. But when I motion palpate the patients, I put my hands right here in the back of their head and look for the motion, of these upper two segments of the spine, known as your C1, C2 vertebrae, your atlas and your axis vertebrae. If there's a lack of motion on either one of these segments here, that'll put direct pressure on their brainstem and can create headaches.
So for people that might not know, when we're talking about the C1, there's different spines that actually do move, and there's other ones. Can kind of demonstrate that as far as which ones specifically move and why that would be important?
Well, the ones that move the most are your atlas up in here, because that's where we get a lot of our range of motion as we turn our head from side to side. The other cervical vertebrae move, but most range of motion is around the C1 area. And so, again, when we palpate that, we make sure that we have a lot of motion in there. And we also make sure that it's equal from one side or the other. A decrease in range of motion from one side would possibly indicate a subluxation or a misalignment of these upper two segments on that side.
Okay. And so just kind of demonstrating, particularly when you're seeing a patient, you could go ahead and kind of demonstrate to me what you particularly do when you're assessing for people who might be dealing with headaches, what you want to be finding. And so if you can go ahead and kind of demonstrate that.
Okay.
All right, so I'm just going to be a patient, and let's kind of move right here a little bit forward. So Dr. Jack kind of show us what he would particularly do with the patient here.
Well, what I typically do is just gently put my hands on the patient's forehead, and I put them in that upper area, that upper cervical area, that C1, C2, that atlas and axis, and just kind of gently palpate in there first. And then I rotate a little bit to make sure that we have the range of motion in there. I may move it forward, I may flex it back. I may laterally bend it on both sides just to make sure that we have that sort of movement, on the upper cervical vertebrae. If there's a lack of motion or movement on the one side, that's usually the side that we address and will adjust.
Okay. You wanted to give me an adjustment? I kind of feel a little headache coming on. Just to kind of show them.
Okay, what we do, first off, there are different ways to adjust the spine, okay? Some chiropractors use a tool known as an activator, which is a very gentle method of adjusting any of the vertebrae, but in particular the atlas and the axis, where we take a little tool and it just kind of gently gets in there and kind of taps the vertebrae in place.
Okay.
I use some of that. I also adjust this manually when I come into the side of subluxation where there's a lack of motion, and I just gently laterally flex the patient, turn, and thrust in the area where the motion isn't working, and that will relieve that motion. They'll have better range of motion, and a lot of times that relieves the headaches instantaneously.
Okay. So yeah, for people who do not like, per se, getting their neck adjusted, some people have that scare. There is, of course, the option of using the activator, which he was just kind of describing. You'd use those targeted points
Correct.
to really help relieve those pains. So what are some things that people can do, particularly maybe at home, to relieve some headaches? So you mentioned about maybe stress and maybe trigger points that people might typically have. I know some people can have really trigger points down the trapezius muscle. That can be kind of a trigger because that's kind of going up to the neck and then the head.
Sure.
So what are some things that you maybe suggest for people to do at home that maybe can't obviously come and see you daily on a basis, but maybe what they could do to help prevent from headaches, or some just kind of exercises that they can do?
Well, the most common thing that I recommend to patients is meditation. Go into a quiet, a darkened room, and just sit there and relax and just focus and just meditate. Think of good things. Think of happy thoughts, which helps decrease the stress in the muscles. All right. And then the other thing that they can do is posture is very important. Sleeping posture is very important. The best way to sleep at night is on your back. And I always recommend for my patients to either bunch up a pillow behind their neck, that their neck is almost in an extended position when they're on their back. Or the second best posture is on your side. And if they sleep on their sides, I always recommend that they kind of bunch their head up and the pillow up and put it next to their ear, so trying to keep their spine as straight as possible, okay? Because you don't want to be stuck in a position where your head is bent over, or it's too fluffy and your head is bent up like this, and then that would also put strain on the cervical spine.
Yeah. I mean, I know for me, like, I have a hard time sleeping my back. I'm a side sleeper.
Mm-hmm.
And of course, there's been times, where I will sleep where the pillow's a little too big. I have kind of a bit wider shoulders,
Sure.
So sometimes I have to kind of equalize that. But I've also been told that even just having, for even heavier people, having a side pillow, especially if you have wider shoulders,
Right.
to roll on, that can help with the shoulder pain as well as the neck. So it's something probably...
That would also be good,
Okay,
yes.
Okay. So just kind of a few other things that kind of share, other things that you can also do that I know I do for my patients is, obviously there's certain things that I've shown in kind of research of taking a combination of magnesium, CoQ10, and vitamin B12 that actually helps with people who have migraines, severe migraines. I know I specifically deal with headaches. I mean, do you deal with headaches quite a bit, or you're one of those lucky people that don't?
I get a headache periodically.
Okay. Me, I experience
But I'm under good chiropractic care.
So other things that you have to kind of keep in mind, other than, obviously structural, we've talked about the structural part of it, but even keeping yourself hydrated. And then Dr. Jack, like he said, keeping that stress down, meditation, things that keep those stress levels down can really be helpful, but also even sleep. If we don't get good quality sleep, so obviously making sure your sleeping position, like Dr. Jack was saying, is good, but even just keeping that stress down so you have a good night's sleep, keep yourself hydrated, can really kind of bring down the causes of having the headaches. But even things like such as ginkgo biloba is a great type of herb. It actually helps increase blood circulation to the brain area, can help with people with migraines or other kind of types of headaches. Now, we talked about the structural headaches. Those are pretty common, but when it isn't particularly structural, but is more has to do with stress related, or if it is more of a brain biochemical process, doing things like ginkgo biloba or even rosemary is another type of herb that actually can help relieve stress because it's another herb that actually increases blood flow to the brain. So those are just a few things that we have that you can use. But thanks, Dr. Jack, for sharing some of these kind of tips. Again, if you guys have any questions for me or Dr. Jack, I'll make sure to kind of get them to him. But leave a comment in the comment section below. If you liked this video, give us a big thumbs up. Go ahead and share with your family and friends. And then if you haven't subscribed to our channel, go ahead and hit the subscribe bell over here or somewhere over here. And then, of course, I love you guys. Thanks for watching. And until next Monday when we talk about more health tip videos, we will see you next time. Thank you. Bye.